I feel like when people hear the word radiation, it has such a negative connotation to it. People always think throughout history, the harm that it's done, the disease that it's caused, but people don't fully grasp the good that it can do as well. Our technology has come such a long way through concepts like IMRT and adaptive that we are able to limit dose to critical structures and really alter the DNA of cancer cells alone. And we can save the healthy tissues surrounding the body.
We are at the point that we are treating 8 to 10 patients a day. The majority of our patients are all treated within 5 fractions. Phenomenal what we can do and how we can do it now. Every patient's plan is adapted. Every patient's anatomy is evaluated for that particular moment that the patient will receive treatment, as opposed to the traditional way of radiotherapy.
We really want to make sure that we give patients peace of mind. What I tell patients who come in to be treated on the Unity is that compared to other forms of radiation therapy, we receive the highest possible quality images so that we can see the tumor better. That allows us to target it more precisely. It also allows us to see the healthy tissues around the tumor so that we can minimize the risk of side effects. And it allows us to track the tumor while we're treating, so that if a patient has to cough or sneeze in the middle of treatment, even just for a second, that beam will pause immediately and we will not deliver any stray radiation to places where it's not meant to go.
Literally, your treatment is created in response to imaging that we got that same day. It doesn't get more adaptive than that. At a very fundamental level, I think that adaptive radiotherapy is important. Its role in brain treatment continues to evolve.
It's 92% effective in all of the patients that we treat. We treat so many different diagnoses. Most people think of radiation oncology and right away they think of, oh my goodness, it's cancer. But we treat so many diagnoses not necessarily cancer related. We treat meningiomas, we treat trigeminal neuralgia, we treat acoustic neuroma, we treat arteriovenous malformations, and we treat various brain cancers as well.
Adaptive is more of a collaborative effort. So on the Unity, you have your radiation therapist, you have your physicist there, and you also have the physician. So you're working hand in hand with the physician. We're improving survivorship based on every patient that comes in every 15 minutes, and they're receiving their treatment. And not only that, but they're leaving hopefully better encouraged, not just healed in a physical sense, but an emotional and a mental sense. Like they're leaving with more encouragement than when they walked in.